Welcome to Business Connection. I'm Liz Spencer. We have Adam Russo with us. He's the owner and executive director of Edgewood Clinical Service. Welcome to the program, Adam.
Thank you.
Tell us a little bit about what you do.
Edgewood Clinical Services is a specialized provider of counseling services to kids, couples, and families. We have offices in Naperville and Plainfield, and what we do is really gear our treatment, toward kids and families. Over half the clients we see are adults, so we don't, we see everybody, but we do have a focus with kids, and because of that, we're able to really gear our treatment to the needs of children, whether it's in a home environment, school environment, or any other place where there might be behavioral or emotional issues that need to be have a targeted treatment plan that we can help implement in those settings.
Now, there are a lot of therapists and clinics in Naperville and in Plainfield. What sets yours apart?
What makes us different is first our size. We, a lot of practices have, they're small, a couple of independent, therapists, or there's the private practices with psychiatrists, and then a whole host of clinicians there. Or there's the intensive outpatient settings that or inpatient hospitalizations that local hospitals provide. We're trying to make ourselves different from all of those.
Okay.
And how we're trying to do that is we're a group of clinicians, social workers, counselors, psychologists. We have a very, I think, a continuum kind of philosophy with medication, whereas we don't believe in meds as a first line of defense, but we're not anti-medicine either. So we definitely work with psychiatrists, but we also want to work with alternative providers to try to keep kids off of medicine, if possible. Sometimes it's unavoidable, but at the same time, we want to look at all options. And then because of our backgrounds with kids and kids with special needs, we're able to take more of the difficult populations and really work with them in a way that many other providers don't have the experience in being able to do. We have great relationships with the community, with local school districts, pediatricians, attorneys. We really try to be involved in that respect to be able to provide well-rounded care. So we want to be able to be a part of what's going on within the facets of the child's life or family's life that really do require those interventions, and not just be the place where people come an hour a week, do some talking, make a plan, you disappear for a week, you come back and you kind of revisit. We want to be involved on an ongoing basis through the week, and that involvement hopefully will help us really hone the treatment plan to be able to truly focus on what's going on. Plus, we also believe that counseling shouldn't be lifelong. We should be able to have some objectives, have some goals, and then be able to see, are we reaching those goals or are we not? And if we're not, let's alter some things to so that we can achieve those goals.
That is a very, the stereotypical, thought about a therapist is you go, you lie on a couch, and every week you go and you talk to Adam, and you tell him your problem. But you're really trying to break that habit and get away from the couch and maybe get into the problems that are, or areas that are triggering that. Because I'm sure it's a lot easier to tell you about it than when I'm stressed out in the grocery store or whatever.
Yeah, absolutely. And and people sometimes, there's when people come in and they want to identify a certain goal, let's say, and sometimes there are other things that come up. So someone might come in and say, I'm getting a divorce. Okay, and maybe that there were other things that happened in their life that, somebody would say, well, maybe we have to talk about all these things. Really want to start with a client-centered approach and understand where are they coming from? What is their, what are they saying? This is the area that I really need some help with. Whereas theoretically, you can say, all right, in their history, there's a lot of these other things where they can also need help with too, but no one's really identifying this. So let's not create something out of nothing. Let's operate with where the client is at. Maybe we'll touch on some history in here and there just to make sure we get an overall picture of things. But if ultimately everything is coming back to the same point, we're going to focus on that point. Again, even though that, contextually or historically, you can say, oh, well, we have to talk about all these things. Sometimes that's not necessary. We really want to make sure that we're targeting what really needs to be targeted so people can start feeling better, and that being the ultimate judge of how we're doing.
How important is the relationship between the patient and the therapist? I would imagine that's something you really have to click to get it to work well.
It is, and at the same time, research shows that relationships only go so far. So whereas relationships are great, you can sit down and people can really ultimately feel comfortable with the clinician right up front, and they can feel good, and they can go for a couple of months, and they can still feel good about their relationship. But after a few months, that relationship will help with making change just because of the relationship. But at some point, that effect will fade, and there does need to be that theoretical or behavioral background that's going to really enhance treatment from there. The relationship can't be the only factor in clinical treatment.
That's good to know. Now, you're very involved with the community. Tell me about your community involvement and why it's important.
We're pretty active in the Naperville Chamber of Commerce. I'm on the Speakers Bureau there. I founded and chair the Healthcare Network through the Chamber, which is a new group. We founded it a little over a year ago. The goal of that group, most healthcare providers, as many people might know, are their own little islands. You know, if someone goes to a doctor, they get referred to a specialist. They go to the specialist. It's hard to get people to talk. You know, the goal of the healthcare group is to take healthcare providers who are part of the Naperville Chamber and put them in a room once a month. It's a competing group. So we could have multiple therapists, multiple chiropractors, multiple, primary care docs, whatever the case might be. We can get them all in a room together, and just so people can network and get to know each other. This enhances everything on a few levels, because it enables the providers to understand how they do what they do. So if there are patients that they might have that might be good fits for one chiropractor versus another chiropractor, or one doctor versus another doctor, they're able to really get to know each other. And same thing, with retirement communities, whatever the case might be. So it really gives a good educational background for other providers to get to know each other. The second focus of that group is to provide community education, and it's something that we're going to be doing, over the rest of this year, is providing quarterly seminars to the community, on healthcare topics, whether it's from dentist to, again, chiropractor and mental health, whatever the case might be, to be involved there.
Well, and the healthcare industry is the largest population, growing sector of the business. So I imagine that type of network at the chamber is really helpful.
It is, and it's a young group, and we have about 20 members attendees that come every month now, and it's continuing to grow, and it's something that I think is going to be really valuable to the community.
Adam, what's the best part of your day?
Best part of my day? That's a good question. I think, I really enjoyed, for me anyway, I really enjoy working with clients who are coming in and that are really challenging. People who have had, whether it's a child who has been struggling for a long time, they've seen multiple providers, there continues to be extreme kind of behaviors being displayed or emotional reactions being displayed by the child. And for me, I like being able to figure out what's going on there and trying to be able to really put things in place, for those kids. I think, obviously it's, we see a lot of people with kind of the genuine, let's say, typical anxiety, depression, things like that. But for me, I really enjoy working with the most challenging, most kind of more extreme presentations of various, emotional issues.
Well, Adam, I wish you the best of luck. Thank you for stopping by, sharing a little bit about what you do and the industry you're in. It's been really interesting to find out more, and we're going to be right back with more Business Connection. Stay tuned.